The next question, I'm on a chronic medication. Should I avoid essential oils? Let's talk a moment about what drug interactions actually are. When we take a food or a medication by mouth, it travels down our esophagus into our stomach. Once it reaches our stomach, all of the blood supply that comes through the stomach is shunted directly to the liver. In the liver, there are a wide variety of metabolizing enzymes known as cytochromes. In common slang, they're called CYPs. They can also be called P450s, and there are dozens, if not hundreds, of CYPs and P450s, 3,4-A, 1A2, 2D6, and many, many more. Genetic variation is key to understanding why some people react very strongly to certain medications and why some people don't, and why do some people why are they able to metabolize something like alcohol so quickly? When I think about, there's a genetic variation in a Korean population that effectively makes some people in that population completely unable to process alcohol. Well, this can also happen when we take things by mouth, such as supplements and medications. Also, elderly people have decreased enzyme activity, and so you may find that metabolism and response to certain substances that you used to take without a problem can have changed over time. Grapefruit oil is probably the most common question I get about drug interactions with essential oils, and that's because there are many medications that are labeled as contraindicated for use with grapefruit juice. This is because grapefruit juice contains many potent drug metabolizing enzyme inhibitors. And when enzymes that metabolize drugs are inhibited, it increases the risk of adverse effect because drug levels thereby increase. Some medications that are contraindicated for use are things like the cholesterol-lowering medications, such as the statin drugs, as well as anti-anxiety, anti-allergy, anti-arrhythmics, antibiotics, antihypertensives, antiretrovirals, and medications for erectile dysfunction. The key to differentiating between grapefruit oil and grapefruit juice is this. The most potent inhibitor found within grapefruit juice is a compound called 6,7-dihydroxybergamottin, or DHB. The important thing is that DHB is found in high concentrations in grapefruit juice, but not in high concentrations in grapefruit oil. That's not to say that grapefruit oil doesn't contain some compounds that on a much smaller scale inhibit drug metabolizing enzymes in the liver, but it does mean that the risk of having side effects is much, much lower with grapefruit oil than with grapefruit juice. As I said, there are bergamottins and bergeptins that are found within grapefruit oil and other citrus oils that are not found within the, that can mildly inhibit liver enzymes, but the likelihood of having any clinically important drug interactions is much, much lower. Next, methylsalicylate. Methylsalicylate is found to inhibit platelet aggregation, and blood thinners such as warfarin and aspirin may directly interact with some of the oils that contain methylsalicylate, such as wintergreen, as well as the blends that contain wintergreen. So if you are using methylsalicylate containing essential oils and are on a blood thinner, it's important for you to talk to your physician or pharmacist about the signs and symptoms of bleeding as well as blood clotting so that you ensure that you have all of the information that you need to take care of yourself.